Good morning, everyone, and happy Thursday. Really glad that all of you had an opportunity to take some time out this morning to be with us. This is Rachel Burgess-Burnett, Deputy Commissioner here, Children's Services Division, and I have with me
Tiffany Junkins, Manager, Family and Support Services.
And just so you know, we are social distancing. So thanks for being here. We know that everybody out there, you're busy and trying to take up your time today, I'm sure. You had a lot of other things that you needed to accomplish. So again, thank you for spending some time. I want to dive directly in, and really what we're wanting to do is just spend some time with you this morning around the health emergency that we've all been living through now, with programs, some of them having been closed since March 13th, around COVID-19. And so the first message that you see here on the screen, and I just want to say that resounding to all of you, that we're all in this together as we're working through what it is that we're doing on our side and also what you're doing on your side. And so this is two things that we want to accomplish today. Number one, talk to you a little bit about what's going on. But again, I also want to spend a little time thanking you for what we know all of you are doing on the other side in support of parents and children. So let's go ahead and get started. And so the Chicago response, and one of the things I want everyone to know, sitting here, Department of Family and Support Services, sitting in a larger entity with the City of Chicago, I want to make sure that everybody is reminded about what is the Chicago response to COVID-19. And so there is that stay-at-home order. It is still in effect. It has been extended, and yes, it is still in effect until April 30th, which means what we're asking everyone to do is stay in. If you're out, to social distance, to protect yourself, to protect your families, and to provide safety for the entire community. The mayor has joined with the governor in doing multiple announcements. There's announcements at 2:30. Governor Pritzker is usually on and giving updates, and Dr. Arati and others are there with him. But we want to make sure that everybody in our community are staying on top of all of what is happening around you and all of the changes, taking in all of the information, and at the same time sharing that information with both your families and with your staff so that we can have a community net that we've thrown around all of those that we serve and all of those that we work with. The order required all residents to stay at home except for essential needs. So we know that there are some businesses that are open and some that are closed. And so here, what we do know that are open are those essential services that we all need in order to continue to live, work, and do everything that we need to do within the system. So we know we've got grocery stores, pharmacies, there's takeout and delivery, there's nowhere you can go and sit down in a restaurant and have a meal. Again, those are strategic decisions to try to keep us all safe. Yes, you can go in and you can buy gas. My joke for everyone is I have not, since I purchased my car, been able to fill my gas tank for $22. And I did just on the weekend. So, you know, there's a blessing in that. And believe me, it will not stay there forever. But we do know that the gas stations are available. It is an essential service. But we also know that there are a lot of things that are closed out there. There's bars, entertainment centers, dine-in gyms, beauty salons. And I wanted to make sure that I captured this because of two reasons. Number one, when we think about those individuals who work in our programs, many of them work in these industries. And so our families are being impacted not just by COVID-19 as a health emergency, but also in their employment and their ability to have income in their households. And so we recognize these are serious issues in our community, and that's why it's so vitally important that we're doing everything that we can to stay in touch with our families, making sure that we know what their needs are. But again, as it says here, it's been extended to April 30th, 2020. We'll be asking everybody to stay in tune with what's going on when we get a little bit further in the presentation. And so there are resources out there at the city level. There are coronavirus updates. There's a text that you can text to COVID-19, and here it is to 78015, and what you will receive are city text alerts. And so this is something you can share with your families, because if they have phones, this is a way for them to get information, for them to find out what's going on, for them to keep up to date, also for you, but also for all Chicago residents to stay up to date on what's going on around us. And I've gotten questions on how to stay up to date, so I just wanted to make sure that everybody understood that there's multiple ways. There's the city website, of course, where a lot of information is housed. And so one of the things we want is to pull up the city website really quickly, reminding you that the City of Chicago website has a lot of information that's out there for you. And I'm going to let Tiffany go over just a few points that we captured this morning for you.
All right, so you have these resources available for you. We're asking that you log onto the city's website where you can see our centralized response and centralized communication. Us as a city, we are working together and we're working in close relationship with the Chicago Department of Public Health to make sure that the latest information is available to you and for you. Across our city, as you know, that there's been a large response in terms of identifying individuals within our neighborhoods and our communities who've been affected by COVID-19. It's astounding the numbers, especially within our Black and Brown communities, the numbers that we're seeing from cases of contracting the cases for the virus, but also for those who are dying. And so we want to make sure, again, that you have access to the latest information and the latest numbers. The last update on April the 15th, 2020, there have been 10,264 cases of COVID-19 identified in Chicago residents so far, and 24,593 in Illinois. So as this outbreak has spread globally, Chicago Department of Public Health is tracking it closely and is using data to guide its response.
And so one of the things that we want to make sure that you know is every day at 11 a.m., Dr. Arwady is doing the Doc is In, and it's live streamed on Facebook and Twitter. And she's there. Sybil Madison, or Dr. Madison, who is our deputy mayor, is here on this photo, and they usually are together giving updates and talk about what's happening around the city of Chicago. But again, it's just another way for you to keep up, find out what's going on, is to hear directly from Dr. Arwady. She usually is there also with the governor when he's doing his presentation, but she's taking time to really sit, answer questions, live stream, and be right there up close and personal with Chicago and state of Illinois residents. So that's another resource for you as well. But I also want to make sure that you know that you can also email at coronavirus@chicago.gov. There's also a phone number where you can actually call into for this, and the information we're going to actually add for you. But right there, if you're looking, if you have any additional questions, and all of this is embedded on the website, just want to make sure people know that they can go, that there's resources and information, because it is critical that we all stay up to date on what's happening in our communities. And so the phone number is 312-746-4835. It's right there on the website, but what you can do is call in and you can get questions answered. The lines are open from 8 a.m. to 8 p.m. and they're manning those phones 7 days a week so that people are able to get questions answered. And many of our parents sometimes are at home wanting to know what to do. Who do I call? Please share this resource so that they know that they can call in if they've got a specific question. They, of course, cannot get results from COVID-19 testing at this number. For that, they would have to go back to their health provider. But if they're struggling and trying to ask the question and say, I'm not sure what I should do, here's one of those resources that we can share with our public so that they can stay in touch and in tune. So again, I just want to emphasize the point, stay home, save lives. If you were listening yesterday, one of the things they said is, the curve is beginning to bend, which is really important for us to find that fewer cases, fewer deaths are happening, and it's not doubling as it had been. I am not the statistical genius around coronavirus 19, and I'm not going to pretend to be that. But I want you to know that these sites are out there, and this is where that information can be gathered so that you have it. You can keep yourselves up to date. You can share this information, of course, across your staff, but I'm also asking that you share it across your parents and also your own personal communities. so that people can stay up to date on what's going on around them. We have got to do everything we can to stay safe. We've got to do everything that we can to keep those safe that we know, come in contact with, and work with. There's some things that everybody's being asked to do, which is, of course, washing your hands. We sent out some information earlier on because we know in our community, in early education, and what we've always done is practice those kinds of techniques and washing hands and keeping children and ourselves safe. This is one of those times when it is really critical. It is critical that we think about it at every given moment, that we're asking everyone to do it, and that we do everything we can to stay safe, because staying safe, staying home does indeed, and we've been able to see that across Chicago and our nation. It does, in fact, save lives.
This has been a very, very difficult time, and I know I've seen, Rachel, and I'm sure you've seen as well, the Mayor Lightfoot videos and the public service announcement videos that she's been doing. And, you know, not to make light of the situation, but it really is trying to put it out there that staying at home, it really does save lives. And so we're asking for each and every one of you to make sure that you're doing everything that you can to make sure that you're keeping yourself safe, but also those around you and the children and families that we serve.
So I want to talk a little bit about some of the things that's been happening through DFSS, and most of you are aware of it, but I just want to emphasize it again. And let's start with our funding and what we've been able to do with the assistance of the federal government and also of our governor to make sure that we are having funding sources available to you. And so when you think about what we've been able to do, which is providing for you the ability to have continued funding, it is critical, especially in our industry, that we're able to continue to pay salaries, because you have got to be able to retain your workforce, or the opportunity that will arise on the other side of this crisis. When you're ready to open your doors, you won't have your workforce, and it is critical. You can't operate your classrooms, can't open your doors, can't do all the things you need to do without your staff. So we have thanked immensely Head Start and the governor for being able to do this through this crisis and through this emergency. Right now, we do know that we are able to continue to pay salaries through our federal grant through June 30th. The governor has extended what he's doing. As he extends his order, he extends the opportunity, and that's why it's vitally important for us to keep up to date with the governor's announcement, and remembering that the moment that we make a difference or a change in the city of Chicago and we make a decision that we're going to start opening again, what we will be doing is coming back to you and making sure that you understand what that means for both federal and state dollars and what we will need to be doing next regarding those. And so more information around that, but again, that continued funding really is imperative in order for you to retain your workforce, and we understand the urgency and importance of that. But one of the things that is also emerged from being able to continue to fund is our necessity to work outside of our walls. We've been telecommuting here at DFSS. Out of the Children's Services Division, we have approximately 70 staff, and actually only 4 of those have actually been in the building in our entire division through this crisis thus far. And I have to commend Tiffany, because we had to be isolated for a couple of weeks. Long story, you'll hear about that later. But because I had to be isolated, Tiffany really did bear it and actually was here at DFSS alone as a individual who was ensuring that we had consistency of messaging for our division. And so I thank her for that. But again, this is very, very serious. What is going on in this crisis is not one that any of us have lived through. I can say that at my age, I've not lived through anything like this as far as this pandemic. As much as we can be planful around influenza, we can be planful around hand, mouth, and foot disease and all these other things that impact us in our world in childcare. This is one that was massive and came at us in a totally different vein. And so the things that we have to do now are different in response to this. And I thank you and I commend all of you for what you're doing. Working outside your walls and connecting and engaging with your staff, working with your parents, staying in contact with them. We've been getting the emails. I know what you're doing, and I commend you for all of your work. There's a lot of real creative juices, and like they say, in crises, that's when we lean on creativity. And I have to say, what I've been able to see, I can see definitely that you all are doing that. And please commend all of your staff We can see what you're doing. We know it's touching families. We know it is meaningful. Isolation is very, very difficult. Being able to have a teacher just reach out and touch a parent, a child to know that their teacher cares, all of those things are imperative for us to get through this with all of what we're doing, because mental health is also necessary as we go through this. And so that's a part of built into connecting and engaging with your families on the outside of your walls. The other piece I want to talk about, and I'll come back to connecting and engaging in just a minute, but I also want to make sure that everybody understands that the federal government, outside of the federal funding that they are allowing us to continue to fund you and your state dollars, the federal government has put out what's called the CARES Act. It's a lot that's built into that, but there's also a portion of it for forgivable loans for child care providers. I'm hoping that those of you know about it. If you don't, that you're learning about it today, and that you should apply for those dollars. It will allow you to use those dollars for a couple of months of operational expenses. And so looking at what does it cost for you to operate your organization, thinking about your salaries and things like that. Those dollars invested in you, it's another meaningful way to ensure sustainability after COVID-19. And so, again, I just wanted to raise that and make sure that people understood that those dollars were out there. If you need some additional resources or information, please feel free to reach out to us. But we want to make sure that we keep you up to date on things that are helpful for you in our industry and ways to help us be sustainable both now and also on the other side of COVID-19. Again, I just want to remind you, please follow the guidance, what you're hearing that is needed. When things change, when things are added, when we're saying about, wearing masks in public and doing all of those things, I hope everybody is heeding the warning and doing everything that they can. But again, we just want to make sure that you're following the guidance that's out there. The CDC, Illinois Department of Public Health, and everyone have joined at the hip to ensure that we can keep Chicago residents and the state of Illinois residents safe. But again, we have to follow the guidance in order to do that. Again, one of the things that Tiffany raised early, we do know that the impact is heavier in our Black and Brown community. And so that's why it's imperative for us working with you is that you share this information. It is critically and vitally important that our people are understanding the importance of doing all the things that we're being told will help us save lives. And so I'm using this as a vehicle to ask you to make sure that you're pushing this information out. I know that you are. I'm just asking you to do a little bit more so that we can do something to bend this curve on the number of our Black and Brown residents that are being impacted by this.
I appreciate that, Rachel. I was just thinking as you were talking about the fact that we have been able to continue funding for our programs, and we're so grateful for our funders to have that opportunity. And as a part of that, then we do have responsibility in ensuring that even though we have diminished services and operations, that we're still looking after and making sure that we're checking on our families, making sure that they're okay, and that we're doing everything that we can do to make sure that our programs are still being covered and to support our families. When we open our doors, we want them to come back, and we're able to do that with this continued funding.
Absolutely. Thanks, Tiffany. And so some of the next steps, and this is about supporting children and families, so thanks for the lead in, Tiffany. It's really looking at, and I just want to expound upon what we know is already happening out there, and then to talk to you a little bit about some of the things that we'll be needing and doing going forward. And so what we know right now, your COVID response has just absolutely been great in community, and I just can't thank you enough. I know that you're doing weekly contacts with families. I can see the data, I see the information that's been shared with us in all the ways that you're connecting with families. But just a reminder that the federal standard is that we, at minimum, are doing weekly contacts with our families. I know you're doing more than that, and I thank you for that. I just want to make sure that at minimum, you are required to connect with your families weekly. And again, the federal dollar is there, sustaining your programs, abiling you to pay, giving you the ability to continue to pay salaries. Therefore, your teachers, family support, and others should have the ability to stay in touch with your family. I also know that you're providing all kinds of resources to families, and just a couple of things that we put here. I know that there's been food packages that's been going out. I know that our agencies are also making sure that their parents are directed to CPS schools where meals are being given away. I know that there's a few of you who have are working with Greater Chicago Food Depository to make sure you're accessing food for your families. I know that families relied on you for diapers, wipes, and also formula, and I thank you for going into your resources and everything and making sure that families have the things that they need in order to sustain themselves. One of the things that we also know in our communities, having been out, you know, the shelves are depleted. The resources that families are looking for are not necessarily on the shelf. And I know they're coming back to you asking for help. And I thank you for being there. That's who we are. That's who we've always been in these times, and who we are every day for our organizations. We are hubs and communities, and this is definitely showing itself to be true of how vitally important all of you are in the community and what we do every day in serving our families. I also know that teachers and family support and mental health providers are still working with families. And again, I thank you for ensuring that those kinds of support services are out there for families. Again, emphasizing the requirement, but again, beyond the requirement, it's just the necessity of keeping in touch with our families and making sure that our families know that you're there. Because what is important, and one of the things that we know we will want, all of us, and definitely all of you, when we emerge on the other side of this, you want to know that you have your families to serve, that they're going to come back and be welcomed back in your door. So everything that you're doing right now is keeping them connected to you. Keeping yourself connected to your families is what will be able to provide for you those families that you will be able to serve once we get to the other side and we're saying, okay, let's begin to look at how do we reestablish ourselves and how do we open up our doors. Those families have gained so much more, not that they didn't trust you before, but so much more trust in who you are for them and their families. And they will definitely want to come back and be a part of what you offer. Connecting to families and connecting them to support services. There are families out there that are suffering because their work has stopped. They don't have the income that they had. And so rental assistance and other things are definitely necessary in getting our families through this particular time. And so there's resources through the Department of Family and Support Services. We are not necessarily connected directly to it, but there are resources out there for rental assistance. I know some delegates in talking with some of you, you've been able to direct families to rental assistance, and I thank you for that. As families are raising their hands and saying that they need these supports, please continue to access those supports that are being built up around the city of Chicago to help our families get through this. The last one I'll point to that I know you're doing is really working with your teachers. I've seen some of what's come through that you're doing teacher training and taking advantage of the opportunity where they're not in classrooms with children all day and using that time, using technology and getting some training done. I also know in talking with one of our vendors, for example, when we're talking to Teachstone, and it was one of the great days that we had in talking to one of our vendors, when they were able to show us data on how many more individuals are working with my teaching partner through Teachstone and working and doing their professional development. I thank you, I thank you, I thank you. It is vitally important that teachers have an opportunity to stay on top of their professional development. And this is one of those times when they have the capability through your technology and the resources that you're giving them, but also now they have some of the time that's afforded, that's not afforded when they're necessarily in the classroom with children, to really pay attention to some of these. So I thank you. And what we'd ask is, for those of you who have not tapped into it, please make sure that your teachers are getting their training and some of their professional development through these next weeks while we are still shuttered. This is a great opportunity for them to focus and get some of what it is that's going to help them be better in their classrooms once we get our doors back open. The last one on this screen is weekly updates to Children's Services Division. In order for us to continue to fund you the way that we are, we have to be able to document all of these efforts. And I just walked through a lot of what we know are happening in programs. And again, we thank you for that. But what we also are going to need to do is document all of these efforts. And so I mentioned that only a few staff have been actually here at 1615 through our division. But when we first went through this and we made some decisions about staff who would telework, there was a group of staff that we did not include as far as teleworking. We've reversed our decision on that, and we will be bringing back our monitoring teams. And one of the reasons that we're bringing them back is so that they can work with our delegates and working with you to make sure that information is being documented in COPA around all of these great activities that you're doing. Because when we get on the other side of this and we're looking at our PIR, we're looking at our report, remember everything that's in that COPA system will port out to the federal government, showing them what kinds of things that we've been able to do. They need to see that we're doing what it is that we said we do, which is staying in touch and in tune with our families, and documenting it in COPA is vitally important. So that team of staff they will still telework, but we're making sure that they have access to their computers. They'll be able to do the work that's needed to work with you, to communicate with you, to make sure that we're able to document all of these great efforts that you're doing. So when we give our report, then the federal government will say, yes, our giving those dollars and continuing those salaries over time was definitely worthwhile, and we can see what the benefit has been for our children and families. So when we get on the other side of this, and we have to be really planful, we have to be planful here at the department, and we'll be working with you. But we also know that you need to be planful on your side. And so thinking about your recovery plan, what is it that you have to do in order to be ready to reopen your door on the other side? And I have gotten some information, and I know there's surveys out there and information in ways that delegates are reaching out to their families to find out, you know, who's serving them right now, all of those kinds of things. And those are great, and we're really happy to see and hear that you're doing that. Internally as an organization, you really need to look at your policies and procedures to see what is stated in there that lends you to be able to have your staff understand the new requirements around COVID-19. For example, yes, we have policies and procedures around when do you come to work, when, you know, if you're sick, and all of those kinds of things. But you really need to look at your policies and procedures and make sure that they speak to a way that you're going to keep yourself safe when we reopen our doors, both for staff coming in your door, families coming in your door, if there's a sick child, if there's a sick parent, if there's all of those things. This is the time now to spend some of your time looking at your policies, procedures, working with your boards and others to really pull together and say, what should this look like when we reopen our doors? One of the things that we heard yesterday from our federal government when we're listening to some of those other reports is that there's a possibility, for example, we get through COVID-19 and we reopen our doors, but just like influenza, it peaks again toward the fall. And so there's some prediction that it may peak again coming up on the fall. So it is really imperative that you think through what kind of policies and procedures do I need to have in place to reopen my door? What kinds of policies in place do I have to have in order to maintain safe and healthy environments for my staff and for my families? And if this peaks again, what will be the triggers where we will pull and say what we need to do internal as far as our organization? Here's an opportunity for you to fit with your policies, your procedures. What have you got in your personnel policies? What do you have in your risk management plan? Because many people, when we first got to this and we were talking about closing, people had not in their own risk management plan thought through what it meant to have to close your door for an elongated period of time. You have many vendors, you have insurance policies, you have all of these other things that you pay for, and all of these other individuals are looking to you to say, if there's a closure, what does it mean for me? For your food vendors, for all of those things that you would normally come in your door on a weekly basis. How do you ensure that you will be able to come back to normal at some point in the future and have all of those vendors at your door? So what kinds of things do you need to do now within your own procedures and connecting and contacting with your vendors to ensure that you still have them and everything that you need? One piece that I do want to put out there, some people, for example, use open kitchens for their food service. I just want to remind you, open kitchens has been the one that's really been working with CPS and others to make sure that the food can continue that's going out to children and families. And so just when you think about that, you're opening up your door, you need open kitchens. Open kitchens is vending right now massively to CPS. Have conversations with them so you can ensure that if you use open kitchens, what do you have to do through your process to make sure that that vendor is ready and capable for you? One other one that I'm going to just speak to is what we're hearing also as far as finding formula for children is really, really difficult on shelves. And we're hearing from vendors that they're not getting the deliveries. This is just one of those that came up. Grantees talking to grantees, for example, where there are agencies that have had to literally contact the company that manufactures Enfamil in order to get Enfamil, because no manufacturer is sorting and delivering some of those products. And so I'm only saying all of that to give you some ideas of things to start thinking about, because there's going to be a day when we say the curve has bent, that we are now on the other side of this, and you're thinking about restructuring and beginning to get your doors open and ready to receive your families and children. Just again, think about all of the things that you need to be thinking about now and getting yourselves ready for that day. And I hope some of what I just said is helpful, and we'll be sending out some other guidance documents as well to you, but I just wanted everybody to start thinking about your recovery plan. We talk about risk management plans. Who knew we'd be talking about recovery plans, but we are now. So I thank you for listening to everything that I put out there. But again, just know that we're here for you, and we're going to be walking through this process with you. And so a couple of things that we want to make sure, and I didn't want to keep you all day. I know that we have another webinar this afternoon that many people have been waiting on us to hear about slot reallocation. So this is a shortened version of what we'll be able to do later. But I do know many of our presidents and CEOs and executive directors have already been contacted and are communicating through a new LinkedIn group for agency networking that's being done at the DFSS level with our communications team. And so I hope that you're doing that. If not, then let us know, and we'll make sure that you can get into that LinkedIn group so that you can get those communications and hear what's going on, where delegates across areas, not just CSD or Children's Services Division, but homeless and others are all talking and have an opportunity to keep each other abreast of what's going on and how this impact is and what it means to them. But right now, with everything that we said today, really this is just our opportunity to connect with you again, knowing that we are still here. We knew we had a date already on the calendar for our next EDPD meeting, so we wanted to use this time accordingly. But what I want you to do, and we've covered quite a bit of information in a really short period of time, but I want you to know that the email address or the info@childrenserviceschicago.com is where I'd like to receive questions from you as we're building out tools, as we're building out and finding resources to help you get through this last phase of COVID-19 and this health emergency, as we prepare ourselves to reopen our door. And what I've said to people, you don't close and open a building like you do a light switch in a room. You can't just turn it off and turn it right back on. This is going to be a work in progress, and we want to be a partner with you through this work in progress. And so after this webinar, I'd ask you for your information at childrenserviceschicago.com, that be a place that you send questions that we can respond to. And I always say, if you ask a question, if you have a question and you think maybe I don't want to ask it because maybe no one else knows it or thinks it's important, I want you to ask that question because somebody else probably needs the answer to that same question. And what we'll do is we'll compile FAQs like we've done before when we've gotten information and questions from you, so that we can be our own thought partners. Let's work together through this as we think through what are the next phases that we need to go through to make sure that our organizations and our families are healthy, are able to reopen, and that you're able and ready to receive your families with open arms in a healthy and safe environment once we can say we've lived through COVID-19. So again, I thank each and every one of you for spending time with us this morning. Just wanted to reconnect with you. We'll be doing this now every 2 weeks. We were having our meetings monthly, but we're going to start doing them every 2 weeks going forward so that we can really dig into some of what we're talking about, partnering with you as we think about what else we need to do in order to formally open up our doors and get ourselves ready to receive all of our children and our families. And so I thank you, and I thank you. And I see that there's one comment and a couple of questions up there. So Dara, thank you for thanking us for the critically important information. Yes, there is information, and we will get the information out to you about rental assistance and how you can definitely make sure your families are accessing that Yes, it is being recorded. Yes, it is going to go up on the website so that everybody has access to the information. So that's what we feel is vitally important, is that you have it and that you can share it and that it continues to go out to everybody that you need to give it to. Again, I cannot impress upon you the vital importance of sharing information with your parents. We have information that we access because this is who we are and this is what we do. But this is not by any stretch of the imagination normal for our families. And so everything that we can give them that helps them think through what they need to do to keep their families safe, to keep them out of harm's way, to make sure that they're protected. And again, everything that you're doing with and for them is one of the things that we want to make sure that you are able to give them what is needed. And so again, I thank you for all of that. And yes, absolutely, Julie, I see your comment up there. June 30th is the cutoff date right now. From what we have in, as far as our stay-at-home order from the governor has been assessing and reassessing Illinois Department of Public Health and others, trying to make some decision about whether or not they're extending the order beyond that date. And so as we move forward, just remember that your programs right now are still shuttered unless you're providing emergency care through April 30th. And as we go further down, we'll know more whether or not there's any extensions to that. And as soon as we know, of course, we're going to be putting that information out there. The other method that we're also going to continue to communicate with all of you, as we have been and we will continue to do, is through our Children's Services update or CSD update. Those will continue to be coming out. And so a question is, what mitigation plan are in place for programs who lose children whose parents choose to stay home? One of the things that we're going to be working with you is on your enrollment. And I will say is that there is some expectation, and I'm going to say this to all of you. There's some expectation of two things on this. There's an expectation of some of your staff who may be home taking care of sick family members or sick children won't be able to come back the day that you want them to come back. You've got to mitigate that risk. We also know that some families who are going to stay home because of their concerns and may not be able to come back. They may have lost their job, a lot of other reasons. And so what we want to do is stay on top of what we're finding is happening out there. And that's why, you know, researching, staying in touch with your family, staying in tune with them on what's going on, and making sure that we can kind of figure out ahead of time who we might lose. Is there some way we can encourage them to come back, but be a little bit more planful on what your numbers might be? That's one of the things in order to mitigate risk and think about your recovery plan is one of those things that I ask everybody to start looking at and thinking about. Will classroom sizes be decreased? That's one of the things that as we get further down the road, as we're hearing, right now we're saying groups of no more than 10. If we go into this crisis and we say we can go back to business, but the numbers have to be smaller, we will be talking to you about how do you work that into your structured plan as far as your classroom environment. So we're trying to stay on top of it. We're asking you to stay on top of what you're hearing as well, so that we can work together on how do we plan for the next iteration of your opening and operating your program. Someone asked if the order will be extended beyond April 30th. And right now we have not heard yet. That's why I'm asking everyone to stay in tune with the governor's messages when he is talking, what he's been doing when he decides to change or extend an executive order. We hear about it at the same time you do, and that's at the governor's press conference. And so I'm asking that everybody stay in touch and in tune with those press conferences. We get it at the same time you do. We activate information going out to you as soon as we get it. But I'm asking everybody to keep up with it. When I said June 30th, what I can say the guidance for June 30th is we have the ability to continue to pay federal dollars through June 30th as far as Head Start. That's the flexibility that they've offered us right now as far as Head Start. If, for example, we went back May 1st, then we would only be using that flexibility up until that particular time. But just know right now there's not been an extension to the order. The governor will be making that decision. Again, please stay on top of it and in tune with his press conferences. I have a very small list of agencies that are through our network. that are providing services. What we will do is I'll send out information to you for the list that is citywide or statewide where essential workers can find childcare. We only have 3 of our partners who are working with us that actually receive licenses. Only 1 is actually open right now. But those are able to do it because they don't have federal funding within their shop. But I will send out the information on how to find a list of sites that are open. The question is, can we still continue virtual engagement and keep those kids enrolled if they're still fearful to come back immediately? And I'm going to say we're going to do everything we can to continue exactly what we're doing because we want to keep them in contact with you. They're your enrolled families. And so, again, that's why we're working on how you will document that. That's why it's important for us to bring back our teams so that we can continue to document this in our system so that we can show all of your efforts. I'm going to answer a couple more, and then we're going to let you put the rest of your questions into info@childrenservices.org. Any guidance that you want to share about PFA-PI vouchering? Vouchering period continues. People can still voucher through our system. I know that our deputy over finance actually put out some information on vouchering to make sure that people are sending them in. You should still be vouchering as you were before for your salaries through the DFSS iSupplier system. If you have any issues with that or you have a specific question, I'd ask you to reach out to Tiffany Junkin. I sent out information specifically on home visiting. And I see there's a question about that, Cindy. I can send it out there again. But what we were asking for home visiting is they still have conversations with their families through whatever means they could, phone, FaceTime, however they were able to do it on the same cadence that they were doing it as a home visitor, that they were still connecting with those parents and those families. And this is what we've been asking at the outset of this, so we can send that back out again. Can agencies still voucher for these programs as well? And when you say these programs for home visiting, you're funded for early Head Start home visiting, you're funded for federal dollars. The absolute answer is yes. You're funded for PI home visiting, for example. Yes, you are still able to voucher for those services.
There's a question about vouchering. It says, can we still charge all non-salary lines? And so what I'm going to ask people to do is think about what is necessary and reasonable within your organization. Everything that you have put in your budget, you may not necessarily be able to use during this time of shutdown. So I need everybody to think about those common sense things that are going to be used within your program to see if those items will be something that you can still take advantage of. I think earlier, Rachel had mentioned the fact that we've had an increase in professional development online. And if you are taking part in something that's similar to that, where there's still going to be kind of instruction going on and guidance for families online and virtual learning, those types of things, absolutely. We want you to go ahead and make sure that you're still able to voucher for services like that. However, something like a field trip, obviously, and bus services and things like that, admissions and things maybe that you have included in your budget, obviously those types of things you wouldn't be able to take advantage of. So I just really need people to kind of think about those common sense things that make sense, and if there's going to be a benefit to the children, families, and staff, okay? And if you have any specific question that really kind of narrow it down, please give me a call, send me an email.
So I see your question, Bella. Can delegates provide emergency care to currently enrolled early Head Start families who qualify as essential workers? My answer to you, and it's the answer that I've been giving consistently, and we'll do it again here. Right now, the answer is no. We have no ability under the federal rule to allow you to open your doors and provide emergency care to those particular families. What we're asking you to do are the things that we've talked about, which is virtual, connecting with families, providing resources and all the other things that you're doing, and being able to document all of those efforts. But right now, our federal dollar will not allow you as an agency that is funded by those dollars to open up your door and provide emergency care. If something changes, if at the federal level, if Office of Head Start, if ACF, or if they change the rule, and the rule changes, they will let us know, and then we will communicate that. But as of right now, the federal dollar is in jeopardy if you're opening up your door and providing emergency services, because it is seen as a different service than what you were funded for. If we have to go back and only 10 children will be able to be in the classroom, will there be a change in funding? I'm not anticipating changing in funding at this particular time, and we'll continue to work with our funders on what it is we need to do. But again, as I said earlier, if, now I'm just going to use this as an example, if 10 children are in the classroom and you have another 10 families who are unable to be there, and you're continuing your extension of work with them, might be a way that we're able to document this. This is what we're working with our funders now, knowing that that may be the case and predicting that some of those things may actually happen. What will they allow us to do under their dollars as we move forward? We're getting clarity on that, and that's the kind of information that will be coming back out to you. Your weekly reports, this should still be sent to the lead of your team. And then what they're doing is they're collecting that information and sending it up so that it can be included in the overall report. And so, yes, your information should still be sent up to your lead over your team. Someone asked a question about budget revisions. If they need to go ahead and move money from one line to another line, do they have to do the budget revision? And you do have to do a budget revision if you're changing funds from one line to the next. And so that can be on any line, whether it was designated for a field trip and now you don't need that money on that line and you want to move it to professional services. Make sure that you're staying on top of the things that you have budgeted, and if you do need to make modifications, that you're getting those modifications submitted. There's a question about in-kind from Tracy Delgado. Tracy, we are going to get back to you, and we will put out information on in-kind. Thanks for asking the question, but we need clarity of the rules from the federal government, and once we get that, then we will come back to everybody around what it is that we can do as far as in-kind. All right, we're going to go ahead and take one more, and then we'll go ahead and answer the rest through an FAQ. I'm trying to, will centers funding be cut if they cannot recover after reopening and ramp up to 100% enrollment for months? I will say this to everybody, and I said it before at our EDPD meetings, that we were already, as a grantee, already under an under-enrollment mandate. And so this has impacted us greatly. But at the same time, we're not the only grantee under the same order. What they're doing right now is they're meeting to discuss exactly how and what they need to do, meaning Office of Head Start, regarding what is predicted to be under enrollment once we get past COVID-19. We're waiting on all of their guidance, and just heard on a call that I was on this week that one of the things that they're doing is that they are saying to us that wait on more information. So we're waiting on them to finish their discussions. As soon as we know how we will roll out this enrollment piece, because right now we are still giving them a monthly enrollment, but that monthly enrollment is static. It's based on where you were when we closed COVID-19 or closed all the centers. And so how we ramp back up for enrollment and what that needs to look like, they're putting together guidance for the nation for all Head Start programs and early Head Start. As soon as we get that, we will let all of you know. So again, I thank everybody for spending time with us, and I thank you for all of your questions. We will be, as Tiffany said, putting these together, getting some information back out in an FAQ. Thanks for spending time with us. Yes, April 30th happens to be the last date of our shelter in place as we know it today. But remember what I've asked everyone to do. Please stay on top of the governor's press conferences where he gives us all of the information, and we get it at the same time you do. When he changes an executive order. If he changes it and extends it past April 30th, we will all do exactly what it is that we need to do to continue to serve children and families, and we will continue to be here for you. So we thank you again for spending time with us today, and we will talk to you via webinar again on April 30th. But please also open up your emails when you get your CSD update, because we're heavy loading them with all kinds of information that we hope is helpful to you. as well. So take care of everyone. And I know many of you will be on this afternoon with Tiffany on slot reallocation. So thanks for taking the time this morning to be with us. Have a great day, everyone. Thank you.